again, namaskar. And it's a privilege to be part of this forum and especially of this team, part of this team. So I have divided my talk into three. One is the three parts. One is the assessment. The second is the intervention, and then the success stories. When we talk about when we're talking about the assessments, it's important that we learn about the characteristics, which Dr. Suma has mentioned also. One is that our children with CVI, with cerebral visual impairment, they have this shows strong color preference, need for movement, visual latency or delay, visual field preference, difficulties with visual complexity, need for light or light gazing and non-purposeful gaze, difficulty with distant viewing, atypical visual reflexes, and difficulty with visual novelty. They do not respond to any new stimuli easily, and absence of visually guided response. Okay, assessment of CVI characteristics. We cannot talk about assessment of CVI characteristics without mentioning Roman-LANTZY. Kristen and the CVI assessments go hand in hand. So the CVI range is the assessment protocol. It is used to measure the functional vision of a learner. It identifies the typical characteristics of CVI that are present in a child. It also evaluates how these typical characteristics influences or impacts the child's or the learner's functional vision. Research has proved that the results are consistent and reliable measures of functional vision. It's a favorite of mine. Why? Because it measures the functional abilities. It's been a systematic guide to me to know my children better, to understand them, to chart their progress, and of course, guides me to understand and to do their programming. It's the ability of the learner and not the age that it focuses on. Parents are part of the assessment, and it's so good to involve them not only at the center but during the home visits. It is flexible and it is not rigid that you need that particular kit. A kit is suggested and the items are suggested, but it's not a rigid rule. Also, it has to be this variation. You have the opportunity to do it in different sections. Like at home, this thing at a noisy environment. Okay, next please. Okay. CVI assessment protocol. It has two methods, CVI rating 1 and CVI rating 2. Rating 1 it identifies the typical characteristics present in the individual. And CVI rating 2 is an overall degree of this characteristic which impacts the learner. It is done through its observation, interview, and direct contact. I love the importance given to parents' interview because it's the parents' interview. The way the interview is conducted, it is more for supporting the parents, for the parents to learn to know their child better. Range is also determined whether characteristics are resolved, child's present level, plus and minus is partially at that level, and minus means it does not apply, it's too high for the learner. CVI rating is from CVI 1 to 2 is from minimal visual response to 9 to 10 is where it functions visually. Like minimum response will be the child is seeing only objects at near distance within 18 inches. Functions visually is beyond 20 feet. CVI 2 is the characteristics are scored on a categorical scale from 0 to 1 with increments of 0.25. This is the degree, the overall degree that impacts, that each characteristic impacts the learner. Okay. Environmental consideration is, we know that the environment affects a child with CVI's visual input. It either helps or it disrupts the functioning of the visual functioning of a child. Many a times the parents have said, "ये अच्छा देखता है जब घर में कोई नहीं होता." It's because the noise has been reduced, movement has been reduced, the child sees better. It's divided according to the levels of level 1, level 2, and level 3, according to how much of adaptations and accommodations are needed in the environment for the child to see. CVI resolution chart. This is a favorite of mine. It's the sum of all of them. It's a comprehensive information regarding the child's visual functioning. It helps in planning programs and also helps in specific activities to help the functional visual abilities of the learner. But I want to tell you this, the resolution chart is much more than just the parts. The whole is more important than the parts. Improvement in the CVI range. I want to show you this. This is little Agastya. He was 5 months when he came. And today so this is at about range 1, and this is at 7 to 8 when he's looking at the mirror. So I'm doing the description in details. Color preference. Our children prefer yellow, red, then they go on to simple patterns and multiple colors. Need for movement. Sorry. This also tells you about the field. Latency, visual latency or the delay. Lots of our children show latency. The latency is also observed when the child is tired or ill or has been overstimulated, which is many a times we special educators and working in vision therapists, we have a tendency to do that, overstimulate. Okay. Field preference. Difficulties with visual complexity, objects. They prefer looking at single colors, simple patterns, rather than complex ones. Difficulties with array, where like this little baby there's so much of stimulation that he refuses to look. A black background helps. If the things are illuminated, it helps. If the objects are illuminated. Sensory dysfunction, removing sensory distractions, it helps. We feel the child is not seen, but it is actually the sound at the back that is distracting the child. Difficulties with faces and making eye contact. This actually makes the parents very sad कि बच्चा मुझे नहीं देख रहा, बच्चा मुझसे नजर क्यों नहीं मिला रहा. Need for light. This is an unpurposeful, non-purposeful gaze, but they're just looking at light or they're looking at objects where there is no, without actually, it's like looking through instead of looking at. Difficult with distant viewing. Atypical responses, where when anything comes close to our face, we have a tendency to blink, or when you touch the bridge of the nose, you have a tendency to blink. But our children with CVI miss on this. Difficulty with novelty, visual novelty. Here the child is looking at the golden stimuli, but as soon as I present a new stimuli, the child refuses to look or is unable to look. I won't say refuses. absence of visually guided reach. We sometimes use vision to, auditory to get the attention of the child, and then we slowly fade it away. You can see that Uzma is aware, she's following, but when it comes to touching, she looks. This is actually, you look away and touch. This is the things, the three words that describe the absence of visually guided reach. Look away, and reach. Finally, yes, brilliant.